The topic we're going to discuss today is over liver cirrhosis. Let's take a look at the liver functions. The first one is metabolizes. So the liver metabolizes things like pathogens, medications, everything filters through the liver and then it goes back into the circulatory system. The liver also makes proteins for blood clotting. That includes PT, which is prothrombin, fibrinogen, and then it also makes albumin, which is a blood protein, which is responsible for maintaining and regulating cellular fluid levels like water in the body from tissues to vascular spaces. Now take a look at this diagram. It is a cross-section of a capillary bed or capillary vessel wall, and we have plasma that's inside our blood volume, and we also have sodium and water and glucose. And the sodium, water, and glucose travel easily, permeate easily through the membrane. Okay, and also the albumin loves to be inside of the vessels. So albumin is a plasma protein, it's a blood product, and it loves to be inside the vessels, and it also loves water. So it helps control the movement of water in and out of the vessels. But the actual albumin does not cross the capillary or the vessel membrane, but it does like to pull water in towards it, so inside the vascular space. And I have my little albumin man here. So my albumin man is pulling the water in towards him, in towards the cells inside of the vessel. So Mr. Albumin loves water and he lives inside the vessels with the blood. That's just something I made up to help us remember that albumin is a blood product inside the vessels, and he loves water and he loves to pull water into the vessels. Come over here and look at the rest of how our liver functions. Next is that the liver regulates the amount of sugar in the blood. It does that by converting glycogen into glucose. So our liver helps store glycogen and releases it as needed into glucose for energy. Next is vitamin storage. The fat-soluble vitamins A, D, E, and K, and some minerals B12 and iron. Those are all stored in the liver. Next, the liver forms bile, which breaks down fats. The bile goes down the bile duct into the duodenum and helps to break down fat. The liver also removes the bilirubin, and bilirubin is created when red blood cells break down. It is considered the byproduct of red blood cell breakdown. Now, some of the bilirubin gets excreted within the bile itself, and some of it goes out through the urine. Bile is actually what gives the stool the brown color. Now let's look at the indirect bili. The indirect bili is also called unconjugated bili, and this means that it is bound to albumin in the blood. So then we have direct bili, which is also called conjugated or free bili. And this one is going to go to the bile, and it is going to go out through the intestines and then either out through stool or urine. So it's free to leave the body. Now, when these tests are added together, they call that the total bilirubin level. Okay, so we have to understand the functions of the liver in order to move forward with the rest of this lecture. So we must understand that the liver metabolizes pathogens, medications, chemicals, anything that we put into our body gets filtered and detoxified through the liver. It also makes proteins for blood clotting. So it makes prothrombin and fibrinogen, which makes the netting for the clots in our body. It also It also makes albumin. Now, albumin is not a blood clotting protein, but it is a blood protein that is made that helps regulate cellular fluid in the body and water in the vessels. It also regulates the amount of sugar in the blood. So the liver converts glycogen to glucose and then glucose to glycogen, and it stores the glycogen and releases it as needed. So think about blood sugar regulation there. Vitamin storage, the fat-soluble vitamins A, D, E, and K, and it also stores vitamins B12 and also stores iron. Now remember, iron likes to piggyback on top of hemoglobin. So if our liver is not going to function correctly, then we may see a low hemoglobin or a low iron level, and it will be related to that. The next one is that the liver forms bile, and bile is the substance that breaks down fats. It also removes bilirubin, which is a byproduct of the red blood cell breakdown. So it's excreted in the bile and the urine. Now there's 3 different ways that we look at the bilirubin lab work. So lab work is indirect bili, and that's the bilirubin that is actually bound to the albumin blood protein, and it circulates through the liver. And then there's a direct bili, which is free, it's just floating around in the body, and it goes through the bile, and then it goes out through the intestines, and either goes out through stool, or it gets reabsorbed and gets put back out through urine. Then if we add those 2 numbers together, we get a total bilirubin. So we do have to understand how the liver works in order to understand the signs and symptoms that we're going to see in just a few minutes for liver disease. Now we're going to look at the causes of liver disease or liver cirrhosis. The first one is alcoholic cirrhosis, sometimes called Leydig's disease, and it's the most common and most preventable. The second one is post-necrotic, which happens after an infection, hepatitis, or drug-induced. So, for example, if you have Tylenol toxicity or an overdose, it could very much affect your liver, and parts of your liver may become necrotic. The next one is biliary scarring. So in your biliary tree, it could happen from cholangitis or an obstruction like gallstones inside the bile ducts that could cause the scarring, and narrowing, which causes a bile back into the liver, and it kind of fries it after that. There's instances of rare diseases that cause liver cirrhosis. I've seen some idiopathic causes where there's really no known reason. And the next one is obesity. Obesity because of fatty liver disease. And that is becoming increasingly more common in our country of America. Now let's look at diagnostic tests. We can do an EGD that will show esophageal varices. The esophageal varices are from portal hypertension or narrowing of the vascular area of the liver, which causes a backflow of blood into the esophagus, which makes the esophagus vessels enlarge, and we call those varices. The next one is lab work. The lab work will also confirm some liver issues going on. But the ultimate way to diagnose liver cirrhosis is by performing a liver biopsy to actually look at the cells and the damage that the cells have to confirm liver cirrhosis.